the very first treatment, you could notice a huge difference just in the overall skin tone. Like even uniform got rid of almost all of those sunspots right from the get-go. And then you started seeing the really crepey skin tightening up.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Katie Conley and Kat Garcia of Touch of Beauty MediSpa. Katie is a certified registered nurse anesthetist with over 6 years of anesthesia experience, building on 3 years of critical care nursing before earning her master's degree in nurse anesthesia. She's also a classically trained vocalist with a degree in vocal performance and sings with the Seattle Symphony Chorale in her free time. A year and a half ago, she and her husband co-founded Touch of Beauty MediSpa in Bellevue, Washington, alongside Kat and her husband, where she blends her medical expertise with an entrepreneur spirit to grow a modern, client-focused practice. Kat is a registered nurse with 6 years of experience spanning medical, surgical, critical care, and travel nursing, including caring for critically ill patients during the pandemic. Drawing from her Filipino heritage, where skincare is deeply cultural, Kat now specializes in anesthetic nursing and is passionate about helping clients highlight their natural beauty. So, Katie and Kat, welcome to the show. Glad to have you here.
Thanks for having us.
Yeah, so how did each of you get interested in medicine?
Well, my parents are both physicians. I was originally thinking about anesthesiology from a physician perspective, but after I finished my music degree and realized I didn't think I wanted to be a music teacher, I went into the nurse anesthesia route. It seemed like I don't know, good career path, I guess.
Okay. And
Yep.
Kat, for
And
yourself.
I mean, of course, I'm Filipino, so I don't know if you've heard, but there's a lot of nurses in Philippines and Philippine culture. I mean, my mom was a nurse for 35 years. My dad worked in the hospital. My sister's a nurse, so it's kind of in the family.
Mhm.
Um, yeah,
Okay, got
it
it.
goes.
So then how did you each make that transition into aesthetics, going from nursing and then getting into the aesthetic side?
Mine was a little, I just took a Botox course. One of my friends was like, hey, come take this with me. We get continued education credit for it. So I was like, yeah, sure, why not? And thought it was kind of fun. My husband has his MBA and always wanted to run his own business. So I was like, hey, wait, this is something that we could do. And I think I kind of dragged Kat kicking and screaming into it.
Not really kicking and screaming. I mean, we I guess always been interested in kind of moving away from Texas, and Hal and Katie have been trying to get us here in Washington for the longest time. So
Yeah,
they're
that's
like, and we're also in our background. I mean, we also have some business background as well. So my husband has MBA, so we were like, you know what, let's do it. We don't have any ties. We don't have kids down. So just we are
it's
up for the
fun.
move.
It's fun, and we really like helping our patients actually get some good results and feel good about
Mhm.
themselves.
Okay. So now with your practice, what would you say are some of the most common treatments that your patients, your clients come to you for?
A lot of tox injections. Everybody calls it Botox, but there's multiple different brands. So
Yeah.
we use one that's called Jeuveau typically, but a lot of tox injections. And then the T-shape,
Yeah.
people are pretty impressed with that one.
Yeah, once we brought in the T-shape machine, it's body sculpting, so it's non-invasive. So a lot of people are interested in that because there's no downtime. I mean,
No surgery,
yeah.
no needles. It's great.
Yeah. Non-invasive, that's always a good way to go.
Yeah, yeah.
Now, also, you do microneedling. And
Yeah.
so microneedling, can you tell me a little bit about what is microneedling? What does it do? I just want to go a little bit deeper into this so people really understand what's the benefits of microneedling.
So it uses, well, microneedling uses micro injuries in your skin to help your skin start to create its own collagen again. After you reach the age of about 21 to 23, you're going to start losing collagen about 1% per year. And then once you hit that perimenopause and postmenopausal area, you're going to lose it much faster than that, 3+% per year. So the little injuries tell your skin to start repairing itself. So you actually start creating your own collagen again. And then we will mix in exosomes as an additional adjunct therapy on with microneedling. They get in there below the tissue and they kind of tell your cells to just start acting younger, basically. They're harvested. Do you want to go into that?
I want to dive deeper into the exosomes and the microneedling part, so we can just dive into it right now.
Okay, sure. So exosomes, the ones that we use, are harvested from a Wharton's jelly from an umbilical cord. So after they harvest stem cells from the umbilical cord, then these are little kind of pieces left over. So they're not actually stem cells, but they're similar in how they function, just not quite as strong as actual stem cells would be. So you combine that with the microneedling and the exosomes together, and you're really going to get an impact on skin tone, texture, and laxity, which is the biggest things that people are looking at. And then we have an RF microneedler that we use as well. So you can have a couple of options. There's a pen and there's the RF microneedler. The RF microneedler also combines radio frequency for heat, adding it to the treatment. So it does basically just increases the impact of the treatment.
Okay. And what would you say is the biggest difference? You mentioned heat for the RF microneedling side, but what's the biggest difference between regular microneedling and RF microneedling?
Yeah, and it is just that you add the heat in with it, the radio frequency, that heat in with it, and adding that in just exponentially increases the amount of collagen that you're going to do. So you're talking about making injuries to the skin with the microneedles themselves, and then adding heat to the mix just increases the amount of collagen that you're going to produce.
Okay, got it. So microneedling in general is really going to be for, I guess, skincare is what's going to fall under. It's really not for body sculpting or body contouring or anything like that.
Well, we do use it.
Yeah, so we do have, I mean, we've had clients that come in, post lipo surgery and everything, and they have that extra skin in their stomach. So we have used the RF microneedling with that to just kind of help with the collagen production and with the exosomes as well.
Yeah,
So.
to tighten up that like lax tissue. So more for skin laxity though in that area rather than specific body shaping or sculpting.
Okay. And how does it compare to laser treatments? Because I know there's laser treatments out there that you can do for, I don't know what they do exactly for the face, but I mean, what's the biggest difference between when you would want to use microneedling versus some type of laser treatment?
Most laser is a resurfacing thing. So we can combine our laser treatments with the RF microneedling. And if you think about that, you're basically causing those little injuries to do all the things that we were talking about. And then you add the laser on top to kind of polish the skin, we call it. So it's going to you can do fractionated or fully ablative. And it really just reveals brand new skin right underneath. So get an extra nice glow after you've healed up from it.
Okay, got it. And with the microneedling, is it typically like one treatment? Do you need multiple treatments for it to really get the most out of it?
So typically we do about 3 to 4 sessions of microneedling, depending on, each person. One session you can see a result, but typically it's 3 sessions, and after 6 months after that last session when you really see the
full results.
Yeah.
I think I don't want to, I can't remember the exact number off the top of my head here, but I think you can have almost up to like 600%, 300 to 600% more collagen production with repeat treatments. So it's like one treatment, yeah, it's great, but doing repeat treatments, especially when they're in that 4 to 6 week period from each other, like spaced apart, it really helps build that and continue to make collagen for a longer period of time.
Got it. Okay. And I'll go back to the exosomes because that's something that is kind of more in the camp of regenerative medicine. I don't know if many people really have heard or know what exosomes are, but I think people have heard of like PRP, maybe PRF. So what's the biggest difference between like the PRP, the PRF, and exosomes?
So to get like PRP, somebody's going to draw your own blood, they'll spin it down, and they'll use all of the like cytokines and extra growth factors that are in your own blood and put them back into your skin, which is good. It's excellent. But your blood is as old as you are.
Mhm.
So if I'm 36, if I take my blood and spin it down, I'm going to put my 36-year-old growth factors back into my face. Better than no growth factors for sure.
Mhm.
But exosomes, at least the ones that we use, they're harvested from the umbilical cord, Wharton's jelly, like I was saying earlier. And the company that we use, or Roseliel, they call it age zero. So I mean, do you want age 36? Or do you want age zero stuff applied to your skin?
Yeah, it's
You want
pretty
age zero.
easy comparison at that point. Which one you're going to choose?
Yeah.
Now, I'm sure you get this question when it comes to PRP, PRF, exosomes. Can you use somebody else's blood, like not your own, but somebody else who's like somebody younger, or is that an option?
Blood, no. You can use just growth factors, and those can be harvested from like say bone marrow or something like that. And that's totally fine. They do have that. I shouldn't say no off the top of my head because I'm sure there's some way to harvest it and make it fine to use because it's not actually the blood itself. It's just products kind of on the side from it.
Mhm.
But I would never, I gotta say, I really wouldn't, even if it's possible, wouldn't recommend just from a totally medical
Yeah.
science side of things, like other people's blood products creep me out.
Mm. And what about anything derived from animals? Like, how is that kind of relating? Because I've heard people now using like salmon sperm to like help with facials and things like that. So like, what's the difference
Yeah,
between animal
I
versus sperm
mean,
versus your own and all that?
it's maybe just how your body can use it. So, like, it's there, your body can use it, but it's not really designed for your body specifically.
Mhm.
I We don't use any of those. I mean, I'm sure there are several multiple reputable places that do. It's just not something that I've personally looked into the science on a whole lot, so I can't really speak to that super knowledgeably, unfortunately.
Okay. So with the exosomes, then, what kind of led to your decision to use exosomes versus any other product or option out there?
Part of it is a finance thing. You need a lot less equipment to give exosomes than you would for, say, drawing blood, spinning it down, all of those things. And then most of it was just because of how strong the exosomes are for regeneration.
Hmm.
Like, I mean, a lot of people, I mean, you're going to have a lot of clients coming in their like 50s, 60s, 70s, and especially at that point, it's like, well, do you want PRP that's that age, or do you want again the age zero?
Yeah. Okay, got it.
And
And
it
for
saves the person an extra needle stick.
Mhm.
I'm sticking a bunch of needles in their faces usually at that point, so save their arms.
Yeah. Okay. And with the exosomes, is this something that's typically done like you're injecting it kind of at a surface level in the skin to help with the skin, I guess, making it look younger, or are you doing it kind of in other areas of the body, or and can it help with other things outside of just the skin health?
I think they do have some things that they've been doing with like injecting them into joints for like joint pain. Again, not really my area, so that I wouldn't know too much about. With how we use the exosomes, once you've broken through the skin with either microneedling or a laser, so you have that initial barrier kind of broken through, then we just apply them topically. We
Mhm.
usually use a sprayer. It feels kind of like cold and nice after you've had the RF microneedling or the heat from the laser on your skin. They do have a really nifty device that I've had my eye on where you can actually just use this really high powered spray, I guess, kind of device to force it kind of more in through force it down in through your skin without any needles.
Hmm.
So that I'm kind of looking into because they you can use it. What's really awesome with that, you can use it especially for hair regeneration.
Interesting.
If the exosomes can get into the hair follicle, then you can help regenerate hair and it tends to grow back in its natural, like for me, darker color than all my gray hairs that are coming in now. But most people are kind of freaked out, well, not most people, but a lot of people are freaked out about needles in their scalp, even worse than their face. So the
Yeah.
kind of like spray device is pretty cool. I kind of want to get my hands on that one.
So it's like a needleless injection machine.
Yeah, yeah, basically. Genius.
Wow. Oh yeah, definitely. Get rid of the needles. Everyone's gonna love that
Yeah,
one.
yeah.
So, what would you say are some of the most common misconceptions or myths that you hear when it comes to microneedling, exosomes, like any of these things that we just talked about?
A lot of people think that when it creates new collagen, they're saying, oh, well, it's just scar tissue. It's like, well, scar tissue is collagen, but you have multiple types of collagen, and it's not actually scar tissue collagen that it's forming. The injuries are really just too small for that. So that's a big one. With exosomes, most people seem pretty readily
Mhm.
accepting of exosomes. I
Mhm.
don't know if it's the licensure here that we're like medical, or if they're just like, well, this is your area, so if that's what you think I need, sure, let's go for it.
Mhm.
I think
Okay,
the age
fair enough.
zero again versus however old you are argument seems to work very
Yeah,
well.
I guess so. I guess I have to like sign me up, take my money. Like I don't
Yeah, yeah.
have no question. Okay, so then when it comes to the actual exosomes themselves, is the quality of the exosome something that the average consumer should be aware of, or is it just everyone has kind of the same exosomes if they're offering it, or are there different levels of quality that people need to be aware of?
For sure, different levels, and that's why we use the brand that we do. Their lab is independently tested. They actually like have a CLIA certified lab saying, okay, when we send you the product, I get the receipt from the lab saying, yes, this is what's in it, and it's clean. There's no diseases, there's no nothing, and all of that sort of thing.
Mhm.
The other thing is how it is stored or how it's preserved, I guess you could say. A lot of brands freeze dry their exosomes and you have to kind of like reconstitute them, which reconstituting stuff is pretty common. I mean, we do that with tox injections all the time. But when you do that with exosomes, it often destroys the membrane around that exosome. You can think about it like this little packet
Mhm.
surrounded by a membrane, and it has all those growth factors and cytokines and all the good things for regeneration in them. And then the freeze drying process tends to destroy that membrane, and then everything just kind of floats out and starts degrading in your vial or whatever you have it in at that point. So definitely want to look into reputable. Is it independently tested and verified? Is it not freeze dried? Is
Yeah.
that the right way to say it? Not freeze dried anyway. And also just like how has it been stored? I mean, that's not really something you can look into as a consumer, I guess you could say. So that more goes to choosing a reputable place for your treatments.
And that's a great segue into this next question. How does someone look for that great provider that's really trustworthy? Like if you had to give them one piece of advice of how they can search, how they can find someone who's just is going to be a really good provider for them, what would you recommend?
I mean, it goes with what the providers offer, like what brands like of exosomes,
Mhm.
you could look up the companies that create those exosomes, even though on a consumer level you can't see everything that us as medical professionals can. But that's the way to kind of see how reputable the spa is.
And also the licensure of the people providing your treatments at the spa. In Washington State, a master esthetician can do a lot of these things, and like they're very excellent. A lot of them are totally excellent. There's no problem with going to a master esthetician for that. What you want to look at though is who their medical director is and how close is that medical director? Because a medical director can be somebody, so we're in Bellevue, but say if we didn't have somebody with advanced practice license like myself who can function as medical director on site or at least very close in the area, then you can set up with a medical director who's, say, a 6 hour drive away somewhere. And then if you have a problem, can you contact that person? How quickly can they get there? How quickly would they be able to assess an actual problem and help you deal with it? So that's kind of the really important thing. And it's not always readily available. It might be something that you have to ask when you go in or if you call a med spa. It's like, okay, who's doing the treatment? And then who, if it's not an advanced practice nurse or an RN or whatever have you, like, okay, who is the immediate supervisor? And then who is the medical director and how close are they?
Got it. Okay. Now, when it comes to educating your patients on the treatments that you offer and the benefits, how do you approach that education part of it? Because I'm sure you get some people that come in with just misconceptions or they have just wrong beliefs about it. So how do you approach that educational part of it?
I mean, answer any questions they have, as truthfully and as, knowledgeable as we can. I mean, Katie does a lot of research. That's why she knows all the things. So,
Some of the things. Yeah, I think it's just a lot of okay, explaining to them why a treatment isn't safe for them, maybe or something. Because somebody might come in and be like, "Oh, I want laser." Like we had somebody with a higher Fitzpatrick skin type, meaning it's just a darker skin. There's more melanin in it,
Mhm.
and she had like a couple of chin hairs. She was like, "No, no, I don't want these," but she wanted it like gone now and stuff. I really wanted that laser treatment, and it's a fairly low risk that she could have hyperpigmentation after the fact with laser on her face, but we just, at least laser hair removal, I should say, on her face. But it's something that we really want to help prevent. So she was like, well, I've had it before at another place. Could we just do a treatment? And I mean, we did settle on doing a very light treatment since she had had a laser before, but since I didn't know like what it was or where, like exactly what settings they use or anything, I was just like, okay, here's what's safe. And typically, when I tell people it's a safety thing, it's to
Mhm.
protect them, people are much more receptive to being like, oh, okay, well, if that's what's safe.
Mm,
Very, very
okay.
few people have I had like be like, well, no, this is what I want, and this is
Yeah.
what you're giving me. And at that point, it's just a, well, I don't think we're equipped to get you the results you want, and I think you're gonna have to probably find that elsewhere.
Okay. So, then do you ever have the issue of people coming in with pictures on like TikTok or Instagram, like, and it's heavily filtered, and like, I want to look like this?
I mean, Haven't had people specifically show me a picture of that, but yeah, they'll be like, that glass skin, can we get it? And it's just like, well, it depends on where you're starting from. I mean, yes, we can absolutely improve skin texture, but if you have really deep, deep, deep pores or very lax skin, those deep wrinkles, it's like you're not gonna look like a cute little K-pop artist.
Okay, now I'm curious, Katie and Kat, what role do you believe that artistry plays in how you approach client care? Because I think when people think about medicine, especially both of you have a really strong background in the, like, I guess, traditional medical side, is that there's a process, there's a protocol in place, and you follow this, you don't kill somebody. But what
Ideally.
role do you believe that artistry plays in how you approach your patient care?
I think it's a lot, especially with the kind of facial, maybe you could say contouring stuff, like with lip filler, for example. It's like what kind of filler you use. We typically use just Kiss, it's by Galderma, and it's a very natural looking filler. I don't love, this is just a personal thing. Like if people like this, it's totally fine for them, but I don't love the look of the really, really giant, big, pillowy lips.
Mm.
And especially on somebody that it doesn't match their facial contour. So if they come in and they want that, for example, it's just a, well, I don't carry the filler that's even possible to do that just because from my personal, I guess you could say, artistic standpoint, that's not something that if I don't like it, love it, I don't think I'm the right person to give that to somebody.
Okay, got it. Now, throughout both of your careers, I'm sure that you've had some tough cases that you've had to work on. So, is there maybe one story that comes to mind that you're okay sharing of somebody that came in, had a tough case or a challenging situation, and how you're able to ultimately help them in the end?
I mean, so we had a client come in for the T-shape body contouring. She had done one session of, so pretty much she lost a lot of weight, you know, I guess worked out and everything. So she still had that loose skin.
Mm.
She tried the RF microneedling on her.
Not with us.
Not with us, yeah. So she had previously tried at another place, the microneedling on her stomach, and it's painful for a lot of people, and not tolerable. So she only did one of that. She's also said that she had done a session of cool sculpting, but she didn't really see the results that she wanted. So she came to us. She did 8 sessions with us, and I mean, you can really tell the difference between her first picture with us and then her last one with the skin laxity in her abdomen and her back and everything. So I mean, yeah, it felt great to be able to provide that kind of results, for
Especially when she tried other things and like hadn't worked out.
yeah.
No.
Yeah, I think those are always the best stories. It's the ones that it's almost like you're the last stop for them. Right, everything else, and then
Yeah.
you're able to give them great results. And like, man, I wish I would have come to you first and get this result.
Yeah.
I had one actually it kind of ties in with all this RF microneedling and exosomes that we've been talking about. She had used sun like tanning oil on her face and laid out in the sun as a teenager. So tons and tons of sun damage. Like we're definitely talking crepey skin, uneven tone, meaning like lots of sunspots, those dark spots across her face, and then really, really deep and pronounced wrinkling. It's just from sun damage. It's pretty impressive actually. And as she put it, my face looks like a 10-car pileup. So we got her in, we did 3 sessions of RF microneedling. At that point, I didn't have exosomes yet, so I only had growth factor to use for her, which is good. It's just I would have loved to have been able to use exosomes on her looking back at it. But after the very first treatment, you could notice a huge difference just in the overall skin tone. Like even uniform, got rid of almost all of those sunspots right from the get-go. And then you started seeing really crepey skin tightening up. She still has some crepiness. I won't lie about that. And then the deep, deep wrinkles really softened up as well. I mean, again, when you have that level of sun damage, I told her to get rid of this, you're going to need a facelift, but like non-surgical interventions, like we can help. And after 3 sessions, again, her words, she decided it was now a 5-car pileup instead of a 10 on her face.
Better.
But she kept on getting all these compliments about how glowy she looked. Her friends were like, "Oh my goodness, you look years younger." Like I think it made her really impactful. Well, impactful impact. Great impact for her.
Got it. Okay, great stories then. Now I'm curious, where do you think the future of aesthetics is going?
Oof.
Oh, I mean, like anything, like technology, there's always new machines, upgraded machines, upgraded, treatments and stuff like that. So really, I don't know. I mean, we get
I feel like
exosomes
sky's the
for,
limit.
yeah, we get exosomes from umbilical cords, like,
Yeah, what else are we gonna do?
yeah.
I mean, they have a fairly new laser that's come out. I believe it's ultra clear, and it does this like laser coring technique. So you could do that like in even like maybe even skip the RF microneedling.
Hmm.
And I've seen great results, like especially with the baggy, puffy under eyes of that like tightening up so you just look less tired and way more refreshed and awake. I mean, I can't even imagine, honestly, where it's going to be in like 10 years. It's just, I feel like there's a new rep pounding on my door every day with a new cool toy and I want to buy it.
Okay, and I'm curious for your practice, Touch of Beauty MediSpa, what's your vision for the practice?
Ooh, I mean,
We've been open only a year and a half, so the
yeah.
vision is to get it fully off the ground and running.
Mhm.
I
Good
mean,
start.
we talked about it kind of expanding,
Yeah,
opening up
I'd like to do somewhere between 3 to 5 locations eventually.
Okay.
Just finding the correct locations to
Yeah.
expand on out to.
Mhm.
And yeah, going from there. I wouldn't want to think of something like bigger than that, just because even though I'm not running the business side of things at all, it just seems like it would be too unwieldy at that point and not like a small enough place where I felt like I still had the ability to have my personal touch in all of the areas. So, not like a keep it kind of small neighborhood place rather than like, I don't know, Skin Spirit, not to badmouth them. They're fantastic, but they're just huge.
Yeah, I got it. I got it. Okay, well, Katie and Kat, I have one last question for you, but before I ask it, I do want to point people to your website at touchofbeautymedispa.com. Now, the last question for each of you is, what does beauty mean to you?
Oh man. I mean, personally, I don't wear makeup. I mean, I used to when I was younger, eyeliner, all that stuff. So for me, it's really keeping that natural, like my natural skin. And I mean, I'm Asian, so a lot of people are like, "Oh, you look like you're in your 20s." And then I got one person who was like, he asked me how old you were, and I was like, "Oh, I'm 36." And he was like, "Oh, okay, yeah, I that you look it." I'm like, "Oh, okay." So that means I need to step up my skincare a little bit more. But like being Filipino, a lot of it is just natural beauty. I mean, I'm dark, so there are some things that I can't do laser wise.
Mhm.
So trying to find different things that I can do for my own skin. Yeah.
Beauty to me is, I guess, it's always in the eye of the beholder. So when you're looking in the mirror, it's just for me anyway, it's more of a do I feel comfortable maybe in my own skin, my own look, as opposed to like, I don't know, all glammed up. I mean, Kat kind of took the words out of my mouth as far as like not wearing makeup or anything like that. I used to have really awful cystic acne, so I would cake on the foundation and all of that all the time and hated how it felt on my skin. So thankfully with owning med spa, again, I get to use and have all the toys.
There you go.
Cleared that up. And I love being able to go makeup free. It's fantastic. Not to mention much less time consuming.
Yeah, and
Okay, well, there you have it. Katie and Kat sharing their expertise. So, where can people contact you in the practice?
You can send us an email. It's info@touchofbeautymedispa.com, or on the website, there's at the bottom of almost every single page, there's a thing where you can just send us a message. You can also call or text us. It's 425-310-2548. And then we do try to do our best to keep on top of the Instagram and Facebook, all the meta messages
Mhm.
as
Okay,
good as we
awesome.
can.
Well, this is awesome. Thank you both for coming on and sharing your knowledge.
All right, thanks for having
yeah,
us.
thanks for having us.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.